Welcome to this video on heart failure, a critical condition affecting millions worldwide.
In this video, we'll dive deep into what heart failure really means, exploring the two main types: systolic heart failure, where the heart struggles to pump blood effectively, and diastolic heart failure, where the heart can't fill with enough blood.
We'll also discuss how this condition leads to fluid buildup in the lungs, commonly known as congestive heart failure, and the global impact it has. Stay tuned as we uncover the causes, symptoms, and advanced treatments for this life-threatening condition.
Heart failure, a critical condition.
Heart failure refers to a condition where the heart cannot supply enough blood to meet the body's demands. This can happen in two main ways. Systolic heart failure. The ventricles of the heart can't pump with enough force during systole. Diastolic heart failure. The heart doesn't fill with enough blood during diastole. In both cases, blood backs up into the lungs, causing congestion or fluid buildup. This is why the condition is also commonly known as congestive heart failure, CHF.
Global impact of CHF.
Congestive heart failure affects millions of people worldwide. Since it means that the body's needs aren't being met, it can ultimately lead to death. The widespread nature of heart failure is partly due to the variety of heart diseases, such as ischemia and valvular disease, that impair the heart's ability to pump blood effectively and, over time, can lead to heart failure.
Systolic heart failure, a mathematical perspective.
Let's start with systolic heart failure. A mathematical way to think about this is through cardiac output, the volume of blood the heart pumps each minute. Cardiac output is calculated by multiplying the heart rate, number of beats per minute, by the stroke volume of blood ejected with each beat. For example, an adult heart might beat 70 times per minute, with each beat ejecting 70 milliliters of blood. The cardiac output would be 4,900 milliliters per minute, or almost 5 liters per minute. However, not all the blood is pumped out with each beat, only a fraction of the total volume is ejected. The ejection fraction is the percentage of the total blood volume that is expelled with each beat. A normal ejection fraction ranges from 50% to 70%. An ejection fraction below 40% indicates systolic heart failure, because the heart is only squeezing out a small amount of blood with each beat.
Diastolic heart failure, when the heart doesn't fill enough.
In diastolic heart failure, the heart pumps strongly enough, but it doesn't fill with enough blood. In this case, the stroke volume is low, but the ejection fraction remains normal because the total blood volume is reduced.
The Frank-Starling mechanism and diastolic dysfunction.
Even though both the stroke volume and total volume are low, 44 milliliters divided by 69 milliliters still results in an ejection fraction of 64%. In this scenario, the failure is due to abnormal filling of the ventricle, meaning the chamber isn't fully loaded or stretched out in the first place. This condition is referred to as having a reduced preload, which is the volume of blood present in the ventricle right before the ventricular muscle contracts. A key relationship between systolic and diastolic function is the Frank-Starling mechanism. This principle demonstrates that filling the ventricle with blood during diastole and stretching the cardiac muscle increases the force of contraction during systole, thereby increasing stroke volume. It's similar to stretching a rubber band, which snaps back harder when stretched, except the cardiac muscle actively contracts, whereas the rubber band passively returns to its relaxed state.
Types of heart failure.
Heart failure can affect the right ventricle, the left ventricle, or both. This leads to right-sided heart failure, left-sided heart failure, or biventricular heart failure, involving both ventricles. Each type can involve systolic or diastolic dysfunction. However, if one ventricle fails to pump enough blood, it can affect the other, as both ventricles work in series. For example, left-sided heart failure could lead to right-sided heart failure and vice versa. These terms refer to the primary problem affecting the heart, essentially, which side failed first.
Causes of left-sided heart failure.
Left-sided heart failure is often caused by systolic dysfunction, or pumping failure, usually due to damage to the heart muscle, myocardium. This damage weakens the heart's ability to contract forcefully and efficiently pump blood. The most common cause of this is ischemic heart disease, resulting from coronary artery atherosclerosis or plaque buildup. In this case, reduced blood and oxygen flow through the coronary arteries damage the myocardium. If the coronary artery is completely blocked, it can lead to a heart attack, leaving scar tissue that doesn't contract, further impairing the heart's function.
Hypertension and heart failure.
Long-standing hypertension is another frequent cause of heart failure. As arterial pressure increases in the systemic circulation, the left ventricle struggles to pump blood against the higher pressure. To compensate, the left ventricle undergoes hypertrophy, where the muscle walls thicken to generate more force. However, this increased muscle mass also demands more oxygen, and the thickened muscle compresses the coronary arteries, reducing blood supply. This imbalance between oxygen demand and supply weakens some of the ventricular muscle, leading to systolic failure.
Dilated cardiomyopathy and heart failure.
Another potential cause of heart failure is dilated cardiomyopathy, where the heart chamber enlarges in an attempt to fill the ventricle with larger volumes of blood preload and stretch the muscle walls.
Frank-Starling mechanism and systolic failure.
The Frank-Starling mechanism suggests that increasing the preload, or the volume of blood in the ventricle before contraction, can enhance contraction strength. While this can temporarily improve heart function over time, the ventricular walls may thin and weaken, leading to systolic left-sided heart failure. For the heart to function effectively, the ventricular walls must be the right thickness relative to the chamber size. Any significant deviation can lead to heart failure.
Diastolic heart failure and hypertension.
Though systolic failure is more common in left-sided heart failure, diastolic heart failure, or filling dysfunction, can also occur, especially in cases of hypertension. In hypertensive patients, the left ventricle undergoes concentric hypertrophy, meaning the heart muscle thickens inward, crowding the ventricular chamber and leaving less room for blood. This can lead to diastolic heart failure, in addition to contributing to systolic dysfunction.
Other causes of diastolic failure.
Concentric hypertrophy can also result from aortic stenosis, narrowing of the aortic valve opening, and hypertrophic cardiomyopathy, a genetic condition that causes abnormal thickening of the ventricular walls. Restrictive cardiomyopathies further contribute to diastolic failure by making the heart muscle stiffer and less compliant, reducing the ventricle's ability to stretch and fill with blood.
Kidney involvement and fluid retention.
When the heart doesn't pump enough blood, reduced blood flow to the kidneys activates the renin-angiotensin-aldosterone system, RAS, causing fluid retention. This increases preload, and through the Frank-Starling mechanism, strengthens contractions. However, in the long term, fluid retention can cause excess fluid to leak into tissues, worsening symptoms like fluid buildup in the lungs and other parts of the body.
Pulmonary congestion and edema.
A key clinical sign of the heart's inability to pump enough blood forward is blood backing up into the lungs. This backup raises pressure in the pulmonary veins and capillaries, leading to fluid moving from blood vessels into the interstitial space, resulting in pulmonary edema or congestion in the alveoli of the lungs. This extra fluid hinders oxygen and carbon dioxide exchange, leading to dyspnea, difficulty breathing, and orthopnea. Difficulty breathing when lying flat. In orthopnea, venous blood flows more easily back from the legs and gut to the heart, further increasing pulmonary congestion.
Pulmonary complications and left-sided heart failure.
In left-sided heart failure, the accumulation of fluid in the lungs can lead to crackles or rales heard during auscultation as the patient breathes. If enough fluid fills the lung capillaries, they may rupture, causing blood to leak into the alveoli. Alveolar macrophages then ingest these red blood cells, accumulating iron and turning into hemosiderin-laden macrophages, also known as heart failure cells. To manage left-sided heart failure, ACE inhibitors can be prescribed to dilate blood vessels, improving blood flow. Diuretics are also commonly used to reduce overall fluid buildup, helping to prevent worsening hypertension and further heart failure.
Right-sided heart failure. Causes and effects.
Right-sided heart failure is often a consequence of left-sided heart failure. As fluid buildup increases pressure in the pulmonary artery, the right side of the heart struggles to pump blood effectively into the lungs, leading to biventricular heart failure. However, isolated right-sided heart failure can also occur, often due to conditions like a left-to-right cardiac shunt. In such cases, blood flows from the higher pressure left side of the heart to the lower pressure right side, increasing the fluid volume in the right ventricle. This can lead to concentric hypertrophy of the right ventricle, making it more susceptible to ischemia, systolic dysfunction, and reducing its compliance, diastolic dysfunction.
Chronic lung disease and right-sided heart failure.
Chronic lung disease is another potential cause of isolated right-sided heart failure. When the lungs struggle to exchange oxygen, low oxygen levels, hypoxia, cause pulmonary arterioles to constrict, raising pulmonary blood pressure. This increased pressure makes it harder for the right ventricle to pump blood, leading to right-sided hypertrophy and heart failure, a condition known as cor pulmonale.
Systemic circulation and right-sided heart failure.
In contrast to left-sided heart failure, where blood backs up into the lungs, right-sided heart failure causes blood to back up into the body's systemic circulation. This can result in jugular venous distension, where the jugular vein becomes engorged and visible in the neck. Additionally, when blood backs up into the liver and spleen, fluid can leak into the interstitial spaces of these organs, causing hepatosplenomegaly, enlargement of the liver and spleen.
Complications of right-sided heart failure.
The fluid accumulation in right-sided heart failure can extend beyond the liver and spleen, causing significant discomfort. Prolonged liver congestion may lead to cirrhosis and eventually liver failure, a condition known as cardiac cirrhosis. Additionally, excess fluid near the liver and spleen can move into the peritoneal space, leading to ascites. This fluid buildup in the peritoneal cavity can be extensive, as the space can hold a large volume of fluid before pressure increases.
Edema and fluid retention.
Right-sided heart failure also causes pitting edema in the soft tissues of the legs. This is characterized by visible swelling, where pressing on the tissue leaves a pit that slowly returns to its original state. The legs are most affected due to gravity, causing fluid to pool in the dependent areas of the body. When lying down, fluid may accumulate in the sacrum or lower back.
Treatment approaches.
Treatment for right-sided heart failure is similar to that for left-sided heart failure, especially since it is often a consequence of left-sided failure. ACE inhibitors and diuretics are commonly prescribed to manage fluid retention and blood pressure.
Arrhythmias and advanced therapies.
Heart failure can also lead to arrhythmias, where the heart's ventricles lose their synchronized contraction, reducing their ability to pump blood effectively. In such cases, cardiac resynchronization therapy, CRT, with pacemakers may be used to stimulate the ventricles to contract simultaneously, improving blood flow. For severe heart failure, ventricular assist devices, VAIDs, may be implanted to assist the heart in pumping blood. In end-stage heart failure, where other treatments have failed, a heart transplant might be the only option. Thanks for watching and sharing this video with your friends on social media.